Good morning, everyone. Today we're going to explore a vital, yet often overlooked indicator of men's health: erectile dysfunction. Far from being just an isolated issue, ED is a powerful canary in the coal mine, offering an early warning sign for systemic metabolic failure and your heart health. It serves as a crucial vascular barometer, connecting oxidative stress, insulin resistance, and the health of your blood vessels. Understanding this connection is paramount, as ED can actually precede more severe conditions like coronary artery disease by 2 to 5 years. So when we see ED, it's a signal to look deeper into your overall metabolic well-being. Looking at the clinical landscape, ED is a remarkably common concern, affecting an estimated 14 to 48% of men globally, with projections reaching 300 million by 2025. This isn't just about a specific function, it's a sentinel marker for your endothelial health, the inner lining of your blood vessels. Think of it this way: your body's smaller blood vessels, like the penile artery, which is only 1 to 2 millimeters, will show signs of trouble much earlier than larger ones, such as your coronary arteries at 3 to 4 millimeters. This makes ED an invaluable early warning system. We categorize the causes into 3 main areas: vasculogenic issues, which involve reduced nitric oxide, and atherosclerosis neurogenic factors, like nerve damage from diabetes and hormonal imbalances, such as low testosterone. Now, let's look at what truly powers an erection: the nitric oxide pathway. This is a natural, elegant process. When there's sexual stimulation and blood flow, enzymes like ENOS and NOS release nitric oxide, or NO, from L-arginine. This NO then signals to your smooth muscle cells, increasing a molecule called cGMP. The end result? Smooth muscle relaxation, leading to vasodilation, which is the expansion of blood vessels, crucial for an erection. Our clinical pearl here is profound nitric oxide is the absolute currency of erectile function. Without sufficient NO, other pathways take over, maintaining contraction, which means no erection. So ensuring healthy NO production is key. However, this delicate balance can be disrupted, particularly when reactive oxygen species, or ROS, outpace your body's natural defenses. Oxidative stress is this pathological imbalance. When ROS, like superoxide anions and peroxynitrite, become excessive, they actively scavenge and steal nitric oxide before it can do its job. Think of them as tiny, unseen attackers. While your body has powerful antioxidants like SOD, catalase, and glutathione to neutralize ROS, when the ROS load is too high, it effectively neutralizes the crucial signal for an erection. It's not just waste, it's a direct attack on your ability to perform. A key process in this disruption is what we call ENOS uncoupling. In a healthy state, your ENOS enzyme, with the help of a cofactor called BH4, efficiently converts L-arginine and oxygen into nitric oxide, promoting healthy vasodilation. This is ideal for vascular well-being, but in a pathological state, often due to oxidative stress, this BH4 gets oxidized. When ENOS becomes uncoupled, it no longer produces beneficial nitric oxide. Instead, it starts producing superoxide, which leads to more oxidative stress. This can then form highly damaging peroxynitrite, which not only causes direct DNA damage, but also further oxidizes BH4, trapping your vessels in a permanent, destructive cycle. Protecting this ENOS coupling is vital. So where do these reactive oxygen species, the storm, come from? Many systemic factors drive oxidative stress, and many are influenced by our everyday habits and lifestyle choices. Smoking, for instance, directly induces NADPH oxidase in smooth muscle. Obesity, with its excess adipose tissue, releases pro-inflammatory cytokines. Hypertension, particularly via angiotensin II, activates NADPH oxidase. Alcohol metabolism also generates excess ROS. Even conditions like sickle cell disease, with its hemolysis, contribute. These primary enzymatic sources, NADPH oxidase, xanthine oxidase, and mitochondrial electron transport leakage, are constantly producing ROS, undermining your cellular health and vascular function. Diabetes and the accompanying metabolic chaos act as a significant accelerator of endothelial failure. When blood sugar is consistently high, a cascade of damaging events unfolds. Hyperglycemia leads to mitochondrial electron leakage, increasing ROS production. It also causes glycation, forming advanced glycation end products or AGEs, which inhibit ENOS function. Ultimately, this leads to cell death and the formation of cavernosal fibrosis, essentially scar tissue, in the penis. The clinical pearl here is critical. The combination of low nitric oxide and high ROS leads to the physical death of this cavernosal tissue. Without timely intervention, this fibrosis can make erectile dysfunction permanent. Managing diabetes is essential for preserving vitality. Let's pivot to an essential mineral that plays a foundational role in both insulin function and overall metabolism: zinc. This zinc connection is truly remarkable. Zinc ions are critical for the synthesis and storage of insulin. They're transported into your pancreatic beta cells and are biologically required to crystallize insulin into stable hexamers for efficient storage. But zinc's role doesn't stop there. It also mimics insulin activity by inhibiting PTP1B, an enzyme that turns off insulin signaling. By doing this, zinc prolongs the pathway for glucose uptake, making your insulin work more effectively. Zinc is truly a structural guardian of insulin. However, in individuals with conditions like diabetes, we often see a vicious cycle called hyperzincuria, leading to metabolic destabilization. High blood sugar, or hyperglycemia, impairs both insulin secretion and the function of the ZNT8 transporter, which brings zinc into cells. This leads to a systemic zinc deficiency. Data shows that diabetic patients have significantly lower serum zinc levels, around 66.5 micrograms per deciliter, compared to 82.6 in healthy controls. This deficiency, combined with impaired renal transport, results in excessive zinc excretion in your urine, creating a cycle that depletes this vital mineral and further destabilizes metabolism. Breaking this cycle is crucial for better health. This brings us to a significant diagnostic challenge: why serum zinc levels can be so misleading. Standard blood panels often check serum zinc, but this represents less than 1% of your total body zinc. It fluctuates daily with meals, stress, inflammation, and even hides in your liver during infection, making it unreliable for assessing chronic status. A much more accurate and reliable indicator for your long-term mineral status is zinc RBC, or red blood cell zinc. This measures intracellular zinc accumulation over the 2 to 3 month lifespan of your red blood cells. Think of it as the HbA1c of mineral status. It gives us a clearer picture of your average zinc levels over time. Zinc deficiency is common, yet often missed, due to relying on the less accurate serum test. So, how do we recognize the signs of zinc deficiency? There's a distinct zinc-deficient phenotype that can manifest in various ways across your body. You might notice alopecia, or hair loss, and dysgeusia, which is a loss of taste or smell. Rashes and skin lesions, similar to acrodermatitis enteropathica, can appear. Nail dystrophy, such as Bow's lines or brittleness, is another indicator. Digestive issues like diarrhea and general metabolic instability are also common. And crucially for our discussion, hypogonadism, or low testosterone, and erectile dysfunction are frequently linked. Certain risk factors also increase your chances vegetarian or vegan diets, where phytates can block absorption chronic alcohol use, and certain medications like diuretics and PPIs. Now, let's talk about pharmacotherapy, or medical treatments, and how they go beyond just vasodilation. PDE5 inhibitors, like Viagra and Cialis, are well known for blocking the PDE5 enzyme, which allows cGMP to accumulate and promote smooth muscle relaxation, leading to an erection. But interestingly, they also have a beneficial secondary action. They can reduce oxidative stress and the generation of reactive oxygen species. Furthermore, adjunct therapies play a crucial role. Statins, often prescribed for cholesterol, can upregulate SOD3, an antioxidant, and prevent ENOS uncoupling. And ARBs, or ACE inhibitors, used for blood pressure, block angiotensin II, preventing the activation of NADPH oxidase. These treatments offer more than just direct relief, they contribute to overall vascular health. When it comes to restoring metabolic balance, zinc supplementation can be a powerful strategy, but it requires smart choices. Not all zinc supplements are created equal. We have a bioavailability ladder. The best forms, offering superior absorption, include zinc picolinate, gluconate, citrate, and acetate. You should generally avoid forms like zinc oxide and sulfate, which have poor absorption and can cause gastrointestinal distress. It's about finding the Goldilocks zone, enough to correct deficiency and metabolic dysfunction, but not so much that you reach toxicity, which can lead to copper deficiency or immune impairment. A key safety limit to remember is that long-term high dosing, above 40 milligrams per day, can deplete copper. However, the efficacy is clear. Meta-analyses show that zinc supplementation can significantly reduce fasting blood glucose levels by an average of 14-15 milligrams per deciliter, which is a meaningful improvement. Let's address the antioxidant paradox. Many believe simply taking high doses of vitamin E and C will solve everything. This shotgun approach, using high-dose monotherapy, often fails in clinical trials because non-specific scavenging can disrupt physiological signaling, meaning it interferes with your body's natural processes. Remember, ROS actually have physiological roles. Total elimination is not the goal. Balance is. Instead, we advocate for a targeted approach, using polyphenols and lifestyle changes. Foods like pomegranate and green tea can reduce arterial oxidative stress. Smoking cessation is incredibly powerful, reversing NADPH oxidase induction, and weight loss significantly reduces adipose-derived cytokines like TNF-alpha. These natural and behavioral interventions work with your body to restore balance, not overwhelm it. In conclusion, achieving sexual health truly requires a comprehensive metabolic approach. We've seen that the root of many issues lies in eNOS. It's a friend when coupled, producing nitric oxide, but becomes a foe when oxidative stress turns it uncoupled. Diabetes acts as the accelerator, driving ROS generation and crucial zinc loss. And zinc itself is the guardian, structurally vital for insulin function and powerful antioxidants like SOD3. Our protocol is straightforward. First, measure your zinc RBC to truly understand your intracellular sufficiency. Second, correct any deficiency with highly bioavailable zinc, such as picolinate or gluconate. And third, manage reduced sources of ROS by addressing habits like smoking and excessive sugar intake, and when appropriate, integrate pharmacotherapy. Ultimately, to treat the erection effectively, we must treat the endothelium, the vital lining of your blood vessels.